around the room. There's about 20 of us in here on any given day. According to melanomafoundation.org, 4 students in this room will get skin cancer. That is 1 in 5. 4 of us will have to fight for our lives against a terrible disease just because we didn't protect ourselves from the sun. Just 5 sunburns in a person's lifetime doubles their chances in developing skin cancer. What is skin cancer? Cancer.gov says skin cancer is a cancer that forms in the tissues of the skin. There are several types of skin cancer. The most common are melanoma, basal cell carcinoma, and squamous cell carcinoma. Right here you can see a picture. They're all asymmetric and have color discoloration, so that's how you can tell when you check. Then most skin cancers form in older people on the back of the legs or on the back itself when their body is exposed to the sun in the early stages of life. One solution to this problem is to wear sunscreen. This will protect you from damaging UVA and UVB rays. Sunscreen is labeled with an SPF number. SPF stands for Sun Protection Factor. According to melanomafoundation.org, SPF ranges from 2 to 100. The recommended SPF, however, is from 15 to 60, depending on your skin sensitivity. You should wear sunscreen whenever you are in direct sunlight, no matter if you're inside or outside or the seasons. Wearing sunscreen does have its downfalls, like spending the money to buy it, the time to apply and reapply it, and the thick, oily texture it leaves on your skin after applying it. But a tube of sunscreen only costs an average of $8 at Walmart. And according to skincancer.org, the annual cost to treat all 2 million melanoma cancer patients each year is about $2.36 billion. Let me put these numbers into context for you. Each one of those 2 million skin cancer patients could buy 147 tubes of sunscreen for the same cost. This means each patient that has melanoma could use a tube of sunscreen every 2.5 days. That is definitely enough to protect them from the sun and decrease their chances. Next time you are at Walmart, I challenge you to spend the $8. It may just save your life or somebody else's. Another way to protect ourselves from the sun is to make the choice not to sunbathe. This includes sunbathing in a tanning bed or outside on a blanket. There's laying down tanning beds or standing up. And guys, this still pertains to you. You do sunbathe. Sometimes when you're on the beach, if you're just laying there, you're sunbathing. So don't think it doesn't apply to you. According to skincancer.org, 1 6-minute tanning session increases your risk by 74%. Not only does indoor tanning increase your chance of developing skin cancer, but it costs a fortune. In Baraboo, it can cost up to $660 a year to use an indoor tanning bed whenever you'd like. Though sunbathing makes you tanner and more attractive in the eyes of others, it actually causes you to appear older by increasing the speed of aging and wrinkle production. These 2 solutions to help protect you from the sun, but some others include not going outside between 10 a.m. and 3 p.m., wearing a hat, using sun protective chapstick, wearing UVA and UVB protective clothing, and using protective eyewear. Some of these solutions aren't practical, and I understand that, but a combination of these, among with 2 main ones I explained earlier, can lead to a healthier and happier life. When you buy sunglasses, make sure they have a sticker in the corner. It tells you how protective they are, because some of the cheap ones aren't really protective. And then all chapstick brand is sun protective. According to skincancer.org, skin cancer develops due to the exposure of skin at a young age, normally in the first 25 years of life. This means these are the years we need to be most conscious of our actions. For people like me who have already exposed themselves to these damaging rays, the doctors urge us to get early screening and check once a month for abnormal growth of the skin. Like the pictures I showed you earlier, just check in the mirror when you get out of the shower. It can save your life. Though this won't stop the cancer from growing before it grows, it will catch the cancer before it develops into a later stage or metastasizes to other parts of the body, like the brain or lungs. Once it metastasizes to these parts of the body, the survival rates drop immensely. How many times in the last year have you been burnt? How many times in the last year have you been in a tanning bed? How many times did someone compliment you on your tan? My guess is that last number is a lot lower than the first two. And is it really risking it worth the pain and suffering from cancer or other side effects of sunburn? I would just like you to think about that.